Hello everyone, I'm Tom Parkin and welcome to Colorado Health Matters, where we educate and inform you about treatment options now available in the ever-changing world of medicine. We have teamed up with Colorado's best physicians and healthcare facilities to explore the fascinating world of today's healthcare. So, stay with us because there's nothing more important than your health. Steamboat Orthopaedic and Spine Institute offers care with fellowship-trained physicians in the area of sports medicine, orthopedic surgery, shoulder and elbow surgery, foot and ankle surgery, spine surgery, hand and elbow surgery, total joint replacement, and shoulder arthroscopy. Dr. Alex Meininger is a board-certified orthopedic surgeon with fellowship training in orthopedic sports medicine and tells us about bear surgery, which is a revolutionary option for patients to restore their ACL tear instead of undergoing more invasive reconstructive surgery.
I'm the managing partner for Steamboat Orthopaedic and Spine Institute here in Steamboat Springs, Colorado. We're a single specialty orthopedic group with a multitude of partners that do spine, hand, foot, shoulder, and myself, I practice orthopedic sports medicine. The knee is naturally held together with four ligaments. Ligaments are the structures that attach two bones together. They allow the knee to operate like a hinge. The ACL is the most predominant one because it provides both rotation, stability to the knee, and when torn, it can cause the knee to be grossly unstable, meaning it gives way, wobbles, causes people to fall. So the injury can be quite dramatic. When the ACL tears, it's surrounded in synovial fluid and enzymes that prevent it from naturally healing back together. So the standard of care, the treatment for the last 30 or 40 years has been to replace the torn ligament with what's called a graft. That's the term for placing tissue in a new location. It might be tendon from your own body, it might be tendon donated from the bone bank or cadaver graft. And that graft is then installed within the knee through minimally invasive incisions and arthroscopic surgery. The graft is bolted in place and used to hold the femur and tibia back together and replicates the natural position of the ACL. What's exciting now, or since 2021, is that there's an alternative to ACL reconstruction. So the bridge-enhanced ACL restoration, or the BEAR procedure, is a new operation to restore or heal or regrow your ACL once it's torn. Where a graft may require invasive measures to take tissue from elsewhere in your body or a means to avoid taking cadaver or donated tissue, the BEAR implant lets you keep your natural ACL. The BEAR implant itself is type 1 collagen. It's protein that's made in the laboratory, replicated into a cylinder. The cylinder looks like a generic packing peanut of styrofoam. But that protein is a sponge or a bridge, like in the abbreviation, the bridge-enhanced ACL. Sutures are applied to the ligament. Sutures are put through the bridge to allow a conduit, literally a bridge between the stump of tissue and the bone where it's supposed to attach. The bridge is naturally hydrated or filled with blood and growth factors, and the bridge acts like a sponge to keep those growth factors in place. As we're not harvesting any natural tissue, it's less invasive. We're not requiring any extra incisions, and you're able to heal your own ligament back in place. The operation is more streamlined, requires less surgical time. Patients ensue less muscle atrophy, or they lose less muscle mass, less bleeding or perhaps less swelling in the knee, and an earlier recovery. In December of 2021, we at the Steamboat Orthopaedic and Spine Institute were the first to implement the BEAR implant in Colorado and the Rocky Mountain West, and we've had a robust collection of patients since then. It's generated a lot of patient interest in those that want to forego a graft or pursue ACL surgery and naturally heal their ligament. We also have some of the longest follow-up in that way as early adopters, and so I can safely say, both by physical exam, patient reports, return to sport, we have Division II collegiate tennis players, competitive downhill skiers, football athletes, etc., and everyday persons who are just maybe weekend warriors that have successfully healed their ACL with the BEAR implant.
Dr. Alex Meininger and the team at Steamboat Orthopaedic and Spine Institute comprises a dedicated local and highly trained specialists of 9 physicians bringing world-class orthopedic care to Northwest Colorado and the surrounding region. They bring an unparalleled level of fellowship-trained medical professionals with a mission to provide the optimal patient experience in surgery, treatment, recovery, and rehabilitation from head to toe. The Alpine Center CCPHP in Superior, Colorado is a concierge program to best serve your needs and desires. Nurse practitioner Sarah Sato and Dr. Christopher Fox take time to understand your health goals, as well as your values, preferences, and life circumstances.
The Alpine Center CCPHP was founded as an alternative to the impersonal and rushed corporate-style healthcare that's become the norm today. Treatment approaches are carefully customized to your particular disease, to you and your needs. With a small professional staff, we bring humanity back to healthcare to help you navigate the often complex healthcare arena. Dr. Fox and I look for creative solutions to complicated health problems rather than a one-size-fits-all approach. We are careful and thoughtful as we investigate your problems and design treatment options, and we take time to explain everything to you and answer your questions.
The Alpine Center CCPHP is a concierge program. Let's learn what that means.
Concierge medicine is a healthcare delivery model with a flat annual, quarterly, or monthly fee. By paying this fee, you receive connectivity to your provider whenever you need it. The concierge medicine model gives us, your providers, more time to focus on your health and well-being. In a traditional fee-for-service model, medical providers see as many patients as possible with a focus on volume instead of quality. Concierge medicine offers the opposite. It presents an opportunity for providers to spend more time with their patients, which builds stronger provider-patient relationships. We find this level of care to be tremendously advantageous to our patients. In particular, patients who need support with diabetes or weight management truly benefit from this high-touch preventive care approach. The Alpine Center's concierge medicine program presents a variety of advantages, including extensive amenities for members, extended office visits regardless of medical necessity, 24/7 communication, advanced telemedicine communications, same-day or next-day appointments.
Let's learn about some of the services Dr. Fox and Sarah offer.
More than 100 million people in the United States, including myself, are currently living with diabetes. Type 1 diabetes is usually diagnosed in childhood or early adulthood, but can occur at any age and may be missed in later adulthood. It's an autoimmune disorder that occurs when your immune system attacks the cells that produce insulin. Having more than 30 years combined experience in helping people with type 1 diabetes effectively manage their condition, Dr. Fox and I can help you navigate the hurdles and frustrations associated with this condition. When you have type 2 diabetes, you do produce insulin, but not usually enough to effectively manage your blood glucose levels. Type 2 diabetes is often diagnosed in middle to older age adults, but it has been starting to appear more often in younger populations. It's the most common type, accounting for 90 to 95% of cases. At the Alpine Center CCPHP, diabetics of all types benefit from a personalized treatment approach that combines education, lifestyle design, and technology to manage your symptoms and live a high quality of life. Obesity is a complex problem that usually can't be resolved with pure willpower and the latest fad diet. We offer personalized weight loss guidance and therapeutic options to fit each person's unique circumstance, and also offer medically supported weight loss to help you reach and maintain your goal weight in a healthy, sustainable way.
Almost 30 million adults in the United States have high or borderline high cholesterol levels. High cholesterol may indicate that you're at risk of heart disease or other serious health concerns. We provide comprehensive lipid assessments to determine your risk of disease and offer treatment accordingly. Hormone issues like thyroid problems, low testosterone, or polycystic ovary syndrome can interfere with your energy levels and your weight. If you have one of these conditions, Sarah and I can help.
Dr. Christopher Fox and nurse practitioner Sarah Sato at the Alpine Center CCPHP are at the forefront of healthcare for you and your loved ones. Why take a newborn to the doctors when the doctor can come to you? NayaCare is an extension of hospital care where medical care comes home. NayaCare's packages are evidence-based and research-driven to provide the best comprehensive care by board-certified pediatrician Dr. Sonal Patel.
As a profession, I am a pediatrician and was further trained in neonatology and lactation itself. And so then that gave me the ability to see postpartum. Then I experienced postpartum, and there were so many holes in my own care that shocked me. NayaCare is a home health company specifically targeted to the fourth trimester. and bringing medical care to the house and in one of the most life-changing and vulnerable times in a family's life. We offer several different services. We offer in-home care, we offer virtual care, and then through virtual care we can get what's called pediatrician in your pocket. So in-home care starts right after the birth of the baby, and we come and bring literally the clinic to you, to the house. Those appointments usually last about 60 to 75 minutes, and in it it's encompassed not only the medical care for the baby, but we do address maternal wellness, and on top of that we address safe sleep and any other questions that you will have, including feeding questions, which are the crux of it all, and feeding in whatever fashion that we can support you. I'm lactation, so we also do a breastfeeding session incorporated in it as well. And then those appointments, the in-home appointments, are usually about 3 to 4 in-home appointments for the first 2 months of the program. So in virtual care, it's the telehealth portion of it. So my patients, when they are part of the program, they have direct access to me. They can text me, we can get on a phone call, we can get on a virtual call, just to make sure that they feel supported through it. And then lastly, the pediatrician in your pocket was devised actually from an urge of my patients, because they didn't really want to break up with me. They wanted to transition. And so the pediatrician in a pocket is a service that when they go back into the medical system, they still have access to me. So then you just really do get the support in whatever fashion fits your family, from the in-home all the way to virtual. So in-home care and providing support really around the 4th trimester leads to increasing breastfeeding, decrease in infant mortality, decreasing in postpartum depression. And those are all variables that we measure in research, but they also have an economics to it. So for example, if you breastfeed longer, those kids don't have as many ear infections, right? And so then you are saving healthcare dollars on that sense. Now, when you go back to it, the other place that we really don't talk about is maternal mortality. Maternal mortality in the United States, we have one of the highest maternal mortality rates as an industrialized nation. Women are the foundation of families, and you know, they are involved in so many aspects of making that engine run. You know, even a homemaker, I mean, they're involved in their schools, they're involved in the PTA, all of that. Though we don't put monetary value to it, there is an economic value. Now when you say it's a professional woman that does it, that woman has been a professional woman, and now you've taken her, boom, suddenly out of the workplace. And there we can actually measure an economic monetary value behind it.
NayaCare was created to support mothers and families entering life's new chapter. NayaCare is continually growing to keep providing comprehensive care prenatally and postnatally. Please do not hesitate to contact them with any questions or suggestions. They look forward to working with you and your family. Cleft lip and cleft palate are splits or separations in the upper lip and mouth that occur while a fetus develops in the uterus. Babies born with a cleft lip or cleft palate may have difficulties eating, both from the breast and a bottle. They may also have trouble speaking, and they often have fluid behind their eardrum that can affect hearing. Dr. Brooke has an adult and cosmetic reconstructive practice at the University of Colorado Hospital and is the co-director of the craniofacial surgery program at the Children's Hospital of Colorado, and tells us how she treats this condition.
So cleft lip and palate is a condition in which a child is born with what's considered a birth defect or a facial difference. It can be a combination of lip and palate or isolated therein. It can also be unilateral, bilateral, complete or incomplete, depending on the causative factors. So the cause of cleft lip and palate can be multifactorial. It has an influence from genes. It can actually be related to a syndrome. It can be passed on by parents, or it can be related to the experience of the pregnant parent. Diabetic diagnosis, exposure to smoking or alcohol, or certain medications as it relates to epilepsy might contribute to the evolution of a cleft lip or palate. Cleft lip and palate together is about 1 in 1,600 kids. Cleft palate alone is about 1 in 1,700, and cleft lip alone is much more rare, maybe 1 in 2,800. This is the incidence in the United States. If cleft lip or palate were left untreated, you may have difficulty not only with speaking and eating, drinking. You could potentially have more ear infections, and you might have some of the potentially negative psychosocial implications from having a facial difference that's unrepaired. When thinking about how to diagnose and treat cleft lip and palate, it can often be diagnosed prior to delivery through an ultrasound, say at 20 weeks. Cleft palate may be more difficult to see until the child is born. And other conditions like submucous cleft or bifid uvula may be diagnosed much later if they're not symptomatic at first. So if we do have a prenatal diagnosis, we offer the families counseling. It helps take that level of stress down to something that feels a lot more manageable and treatable. And then we see the families and the baby in our multidisciplinary cleft lip and palate clinic, where they see a multitude of specialists: ENT, plastic surgery, occupational therapy, dietitians, pediatricians, geneticists, audiologists, speech-language pathologists. The list goes on and on. It's a rather long day, but we do have a binder, and we follow up with them with an after-visit summary that gives them a lot of the information. And we partner with these families for years to come until they're basically adolescents and above. Surgically speaking, the way to treat cleft lip and palate is if the patient has a cleft lip, it's treated within the first year, usually around 3 to 6 months of age. The lip repair is usually 1 night in the hospital and go home the next day. The palate, we aim for doing that before the child has developed a full ability to speak, because the anatomy is so atypical that they'll learn compensations unless we restore the anatomy to what it should be. And then children might need more surgeries, such as an alveolar bone graft, rhinoplasty or nose surgery, maybe a touch-up, and some children actually need what's called orthognathic surgery. It's a jaw surgery when they're fully skeletal and mature. The permission to have this type of relationship and the ability to affect the type of change in a child who would otherwise really have a potentially really difficult go is just a gift. I mean, being able to watch these children thrive, be totally normal, even exceptional, is really really a selfish gift that I get to have with my job.
Dr. Brooke French at the University of Colorado School of Medicine and Children's Hospital Colorado is on the forefront of cleft lip and cleft palate procedures. A senior living residence or assisted living community is a community designed for people with disabilities or for adults who choose to no longer live alone or with family members. Golden Lodge Assisted Living and Memory Care is the area's newest senior living community, located at the foot of the Rocky Mountains in Golden, Colorado.
So our goal is to enhance the lives of residents with an exceptional lifestyle by providing services and amenities in historic Golden, Colorado. Golden is in front of the foothills of the Rocky Mountains, and it's offering residents majestic views from almost every window. We offer 111 rental residents, 75 apartments in assisted living, and 36 in memory care, and all carefully designed by our experienced team. So residents of Golden Lodge enjoy a warm, inviting atmosphere and a vibrant social calendar, along with access to the healthcare services when and if they need them.
Golden Lodge offers assisted living, memory care, and short-term stay and respite stay. Let's learn more.
For assisted and independent living, Golden Lodge offers concierge services coupled with fresh air, peaceful atmosphere, and breathtaking mountain views. Residents enjoy inviting gathering spaces and expansive landscape grounds, restaurant-style dining, a varied social calendar, access to local attractions in and around the Denver metro area, and a caring staff that is available 24 hours a day, 7 days a week.
Well, the Golden Lodge is a place that I'm in now, and it's a place I want to be in because I don't have to worry about anything. They do everything for me. I don't have to do anything. They will make my bed. If I need help going someplace, they have transportation, and I don't have to worry about food. Main thing, they take care of the medicine, which I screwed up when I was at home.
Our memory care team focuses on fulfilling residents' individual needs while fostering a calming, familial environment. Our 3 secured neighborhoods designed to the latest standard of communities feature 36 studio apartments overseen by an experienced director and staffed by compassionate team members trained in dementia care. Golden Lodge Assisted Living and Memory Care offers short-term stays, also known as respite stays, for seniors who are recuperating from an illness or injury or are seeking relief from home maintenance. Short-term stays can be ideal when a caregiver needs a break or vacation from the responsibility of caregiving. A senior requires further recuperation following hospitalization or rehab stay. A senior's hospital stay was classified as observational and insurance will not cover the cost of rehab. A senior is interested in a trial stay before deciding to move into an assisted living, and a senior home is being remodeled or they're in process of moving.
Here at the Golden Lodge, we strive for an authentic, community-driven lifestyle that derives its vitality from the Foothill Mountain experience, respect for its history, what has come before it, and our employees whose energy and spirit are its foundation.
The people that work here is wonderful.
Yes, very kind.
But let me tell you, the food is top of the line.
Yes,
Delicious. And if you need something, everybody is ready to help you.
Yeah, very nice.
At Golden Lodge Assisted Living and Memory Care, they take special pride in helping their residents create unique memories by virtue of offering them a wide variety of recreation options, the highest level of authentically great service, and honestly welcoming them to what they feel is the most special corner of the world. Pathways Speech Therapy is a private practice offering comprehensive services for adults with communication, cognitive and swallowing disorders, including consultation, diagnostic evaluations, and individualized treatment programs. Founded by Devin Chisholm, a licensed medical speech-language pathologist with years of experience, Pathways Speech Therapy was established to meet the needs of the growing communities in which it serves.
I'm Devin Chisholm, speech-language pathologist since 2009 and owner of Pathways Speech Therapy. We pride ourselves in being an ally in healthcare for patients and their loved ones. We do this by having the highest standards of evidence-based practice and therapy interventions, and by communicating closely with caregivers and other healthcare professionals. This is paramount to a patient's improvement and ongoing success. Treatment is focused on increasing functioning at home and in the community to promote successful return to work, ability to participate in activities of choice, and overall well-being. We have flexible therapy settings to meet the needs of each patient. So therapy is offered in my office, in your home, or through telehealth. Speech-language pathology is a unique component of healthcare. We have expertise in the areas of motor speech, language, voice, cognition, and swallowing function. Disorders impacting these functions generally result from neurological conditions related to acquired brain injury, such as tumor or stroke or seizures, neuromuscular conditions such as myasthenia gravis and muscular dystrophy, and neurodegenerative diseases like Alzheimer's, dementia, Parkinson's disease, and ALS. At Pathways Speech Therapy, we believe in following scientific research to apply the principles of motor learning and neuroplasticity when appropriate for optimal outcomes in treatment. In addition to neurological etiologies, certain disorders treated by SLPs can be linked to vocal misuse, intubation, respiratory issues, heart issues, tracheotomy, reflux, and cancer. Conditions are often intertwined with mental health, visual, and auditory impairments. I provide speech therapy to those dealing with complex issues and collaborate with other healthcare professionals. As hearing loss is associated with cognitive decline and communication impairment, I also offer hearing screenings as part of my service model.
Devin believes staying ahead of the curve by using the latest technologies. Let's learn about the latest diagnostic equipment that she uses for swallowing disorders.
Swallow function is a complex system involving motor and sensory nerve responses, muscle movements, air pressures, and coordination of breath. Yet, we swallow mostly without thinking about it until there's a problem. Problems can exist in the oral phase, pharyngeal phase, or esophageal phase of swallow. A fiber optic endoscopic evaluation of swallow is an instrumental diagnostic test that I perform. With this, I'm able to directly see what's happening internally when a person swallows food, liquid, or pills, and also allows for assessment of the soft tissues and for clinical signs of reflux. All very important in order to give recommendations and develop an appropriate plan of care for the patient. FEES uses a small, flexible, and fiber optic tube called an endoscope. It has a high-definition camera and light source attached to it. I pass the endoscope transnasally above the floor of the nasal passageway into your throat. It sits above your epiglottis for most of the viewing and gives direct view of a person's pharynx, larynx, esophageal opening, and top portion of the trachea. FEES is a very safe, accurate, and precise test that can identify if aspiration is present and what the source of the swallowing impairment is. I use the very latest state-of-the-art equipment, which is portable and lightweight, so I can perform my test in my office, at a patient's home, or at a doctor's office. I inform your doctor of the FEES results and work with you to develop a plan of care. This may include modifying foods or liquids, training and strategies for safer eating, and muscle strengthening. Pathways speech therapy also offers neuromuscular electrical stimulation, which retrains the brain's pathways for swallowing.
This process is helping me overcome the most frustrating and debilitating issue I've ever had to deal with, and that is memory loss. And I highly recommend Devin and her processes that she teaches to anyone needing help in that area.
Pathways Speech Therapy's philosophy is a blend of compassionate care with treatment that works. Whether it is a new problem or a chronic condition, they can help you find the right neural pathway forward. Well, that's our show for today, and I hope you found the information helpful. If you'd like to see any of the segments from the program again, please go to our website at coloradohealthmatters.com. For everyone on the program, I'm Tom Parkin. Thank you so much for watching, and please join us next time for another edition of Colorado Health Matters.